Hi everybody, Dr. Brad Cobsart. I want to talk to you today about another macronutrient, but today I want to talk to you about carbohydrates. Okay? Some people have a high sensitivity to carbohydrates, some people have a low sensitivity to carbohydrates. So whether it's good or not is going to depend on your DNA, your genetics, and that's something that you can get tested. It's an important test to find out because you want to know if you do have a high sensitivity, that means it's going to be creating a lot of inflammation in your body. We all know that inflammation is a cause of 98% of all disease. Okay, so if you have that high sensitivity to carbohydrates, what do you do with that? Well, you need to keep your refined carbs down to less than 7% of your total daily calories. Okay, so we're not talking about carbohydrates in fruits and vegetables. Okay, we're talking about the refined carbs. Those are the ones you need to be careful of. The other thing you need to look at is the glycemic load. Okay, so many people are familiar with the glycemic index, and that's what we use a lot in our healthcare system, but really the glycemic index doesn't tell us how the food reacts in your body. It tells us how it reacts in a petri dish. Okay, so that's just measuring the food. We need to know how the food reacts in your body. What's it going to do to your hormones? What's it going to do to your insulin? What's it going to do to your inflammation levels? That's what really matters. So you want to look at the glycemic load. And if you have that high sensitivity to carbohydrates, you want to make sure to keep your glycemic load to less than 10. Foods with a glycemic load of less than 10. Okay, and that's something that we share with people, obviously. And then that helps you to make healthier choices so that you're not creating inflammation, which is going to reduce sickness and disease. All right, hope that was helpful. I look forward to talking to you on the next one.